Hi there, Shannon here with Genesis Balance. And today I'm going to be telling you why therapy doesn't work. Yes, I know that sounds crazy coming from a therapist, but trust me, I know what I'm talking about. Are you intrigued yet? If so, stick around and I'll give you my top 5 reasons why therapy isn't working. So, as a therapist, I say all the time therapy doesn't work. What works is the client and them using the resources and the tools that the therapist provides. And I don't know, honestly, if I came up with that or if I heard it somewhere or read it somewhere. But either way, I'm not going to take credit for it. But what I can say is I wholeheartedly believe that therapy doesn't work. Therapy in and of itself doesn't work. The client has to put in some effort and it has to be a good fit with the client and the therapist as well. So, I'm going to go through my top 5 reasons why therapy doesn't work. The number one reason I see therapy not working is that as the client comes in, they are not using the tools that their therapist is providing to them. So, for instance, let's say if I have a client that comes in and says, "Hey, I want some help with goal planning." Goal planning is a really big one with me. I may give them my SMART Goals PDF, my SMART Goals handout that I created. And it's a worksheet, and you fill out the information, it's all laid out for you. So if we sit down in session and we go through that SMART Goals worksheet and we hammer out all the details of the goals and all the tasks and how, each task is going to be achieved, and then the client leaves with the worksheet and they never pick it up again, they never use it, well, of course, therapy isn't going to help you with planning your goals out if you're not going to use the tools that your therapist is providing to you. And I really see that as the number one factor. A lot of people think of therapy in, I guess, the Hollywood sense, where you come in and you sit down on a couch, or you lay down on a couch or whatever, and you just kind of talk about your problems. And that can be a component of therapy, but the major work for therapy actually takes place outside of the therapy office. It takes place away from the therapist. So, as much as we as therapists may want to be able to fix everything, we don't have a magic wand that can just, fix it for you. So, one of the biggest drawbacks or setbacks that I see clients having is that they aren't using the tools that the therapist is providing. Number two, not doing the homework assignments. Now, this one is kind of a stickler for me personally because I'm the type of therapist, I give a lot of homework assignments. I know not all therapists do that, but the way that I provide therapy is very much heavily centered on what the client needs to do to change their circumstances. And so for me, it just makes sense that the client, one, needs to put in the work, but two, needs kind of the guidance and the resources on what it is that they need to work on. So if I give, a homework assignment of, I don't know, one that I really like to do is, hey, you're suffering from depression. So one of my hacks is to make a feel good playlist. And I give that assignment to the client and they come back the next week and I say, okay, did you do your homework assignment? Did you make your playlist? And they say no. But, and I ask them, well, how are you feeling? And they're like, I'm still depressed. Well, yeah, because you're not actually putting the effort into what it is that your therapist is asking of you to do. So that kind of, I think, probably I could have did one and two together when I, think about it. That kind of goes hand in hand with not using the tools that the therapist is providing, because not doing the homework assignments is kind of really along that same line. And it's like, The best time to make a plan is before the crisis happens, not during the crisis. So if your therapist tells you, hey, I want you to practice your deep breathing skills, I want you to practice that method that I taught you in session today 3 times a day. Well, the reason for that is it's a lot easier to kind of pick up that tool and utilize it when you're in a crisis or when things are going wrong if you've already practiced it. So if you never practice the techniques that the therapist gave you via homework assignments and then something happens and you're not able to utilize them, then no, therapy isn't helping. It's not working because you're not able to draw on the skills that the therapist wants you to be able to draw on. So the third one is one that I see often as well. The client is skeptical about therapy. So I get sometimes, not a lot, but I guess I get sometimes clients that aren't really, they're a little bit skeptical about therapy, or they've been told that they have to go to therapy, they've been mandated for therapy, or a lot of the time I get couples where one partner is really into the idea of doing therapy and they kind of put their foot down and said, look, we need to make a change, we're going to couples counseling, or that's it. And the other client is just there to appease the spouse or the partner. And that actually makes it not impossible, because I feel like the it's kind of like the more you throw at the wall, you're going to kind of see what sticks. So over time, I think that it can be helpful. But in the beginning, if the client is really skeptical about, going to therapy and whether or not therapy treatment is going to actually be beneficial or work, you're going to start to see, I think, a lot of that not using the tools because they don't think that the tools are going to work, not doing the homework because they don't see the value in it. So if you're skeptical about the therapeutic treatment, then it's going to be that much harder for the treatment to work. It's just going to add one more layer or one more barrier to you improving your situation or your circumstances, because you're just not going to put as much effort into it if you already kind of don't think that it's going to work. The fourth one that I see all the time is, well, I don't see this one all the time, but the fourth one that I wanted to mention is that the therapist isn't meeting the client where they're at. And sometimes this can be a difficult one because as a therapist, we see often the same types of cases over and over and over again. And so a lot of the time we kind of know what works or what tends to work with that particular type of situation. So that's not to say that it's a one size fits all kind of therapy plan, but we kind of have different ideas of what to kind of go off of when we are providing therapy. We kind of already know, okay, well, this person is coming in and they're saying that they're dealing with depression. That kind of gives me a starting point of where I might need to start. The problem with that is that sometimes therapists may get kind of stuck in their head about, okay, this is where we need to start, this is what we need to do, this is the treatment plan that you need to have, and they're not really meeting their client where their client is. If you come into me and you say, hey, I drink a whole lot, like, I'm drinking, I don't know, say 30, 40, drinks a night, or, whatever outlandish number, you can put to how much you're drinking. And I'm blacking out and I'm not going to work and my relationship is suffering, but I want to come in and I don't want to deal with that. I don't want to work on that. I want to work on my depression. Well, as a therapist, I may be thinking, as alcohol is a depressant, that may be contributing to your depression. So maybe if we taper down on the alcohol, you won't feel so depressed. But that is me thinking in my therapist's mind. I have to step out of myself because therapy isn't about me as the therapist. And I have to look at where the client is. If the client isn't there where, they're feeling like I'm ready to stop drinking or I'm ready to cut down on drinking, it doesn't matter if the therapist feels like that's the right path for the client. It matters what the client wants and where the client is. And one of the reasons I think that therapy sometimes doesn't work is that the therapist is kind of getting tunnel vision and they're not starting where the client is. So, see, you probably are sitting there thinking, oh, this is going to be a therapist, just going off on clients about why therapy doesn't work for them. But no, sometimes it's the therapist as well. And kind of to piggyback on that, the fifth and final reason that I'm going to tell you about is sometimes the therapist is just not a good fit for the client. And even if the client is using the tools and doing the homework and wholeheartedly believes in the process of therapy, if they have not clicked with their therapist and there's not that connection there where they feel comfortable really opening up, therapy is going to be about the most vulnerable parts of you where you're sharing that with someone. If you're not comfortable with your therapist, if they're not a good fit, then therapy just isn't going to work in that situation. So, how do you make therapy work for you? If you've been looking for a therapist, you're trying to decide whether or not therapy is the right choice for you, what I would say is think about what it is that you're struggling with. If you're struggling with something like depression or anxiety, then I would say absolutely therapy is probably something that you want to look into, because any good DIYer, for instance, if you're going to try to DIY self-help yourself, you have to know as a DIYer what you can handle and what is better left to the professionals. So anxiety and depression, those two things, things like that, addictions, things of that nature, I say that those are things that need to be left to the professionals. So, just do your research and find a therapist that you feel like will be a good fit for you. Talk candidly and openly with the therapist and see if it's going to be a good fit. And then from there, really kind of throw yourself wholeheartedly into the treatment process for yourself. That means doing the homework assignments. That means, using the tools. That means giving it a try, of a real honest try. If your therapist says, hey, there's, an intervention or a technique that I want to try with you that I think would be beneficial and helpful, just stay open-minded about it and really put in the work, really try hard to see if that technique or intervention is going to work for you. If it doesn't, it doesn't. But don't go into it thinking, this isn't going to work. I cannot stress to you how important your mindset is when it comes to going into therapy. Having an open mind and having a positive mindset is going to be so helpful in the therapeutic process. So kind of going back to that DIY, whether or not self-help is going to be, beneficial versus therapy. If it's not like something that is, I guess, major, like depression or anxiety, those mood disorders, things like that. If it's something like, just goal planning, something that maybe you could benefit from coaching from, then sure, go for it. Pick up a self-help book, read it, watch videos on it, do your research and try to implement some of the strategies that you find, because not everyone needs therapy. So maybe that is a time where you can do the self-help thing. But the one thing that I want to stress above anything else is just go into it with an open mind. If you do feel like you need therapy, then you're going to need an open mind, because your therapist may push you to things that are outside of your comfort zone. And that's okay. That's what therapy is supposed to do. But just keep an open mind and really focus hard on putting in the time and effort and investment into yourself. So, yes, therapy doesn't work. Okay, how do we make it work? So, I hope that if you are in search for a therapist or you're thinking about trying therapy out, this video was beneficial to you and helpful to you, so that you can kind of get an idea on what to expect and how to get the most out of therapy. If you enjoyed this video, be sure to let me know by clicking that like button below. And make sure you subscribe and click that bell for notifications so you never miss out on this great content that is designed to help you live your best life.